This is Akashvani. In the program Spotlight, now we bring you an exclusive interview with Dr. Roderico H. Ofrin, WHO representative to India on G20 health priorities. The interviewer is Diksha Saxena, Akashvani correspondent.
The World Health Organization was established in 1948. Fast forward 75 years, and today in 2023, when we look back, there are several achievements of World Health Organization globally. Mr. Ofrin, welcome to Akashvani News.
Thank you very much.
India's G20 presidency is indeed a momentous occasion for all of us. India's role in the global health ecosystem is prominent. India is advocating a One Health approach. Can you elaborate on what is on the agenda for India for the global health under its G20 presidency?
The health ministers meeting for the G20 health agenda, and there were three main agenda items. Health emergency preparedness and response, focusing on One Health and antimicrobial resistance. The second was leveraging, India's pharmaceutical industry for medical countermeasures should there be a pandemic. And the third is digital health, where the Global Initiative for Digital Health, or GUIDE, has been launched. So back to One Health. I think many people would know by now that the COVID pandemic had origins from wildlife. That's one of the possible origins of the coronavirus SARS-CoV-2. And so if we want to prepare for the next pandemic, sectors such as wildlife, animal, food, environment, and human health need to come together. So the One Health approach requires a coordinated system in terms of information sharing, surveillance, even planning and simulations and exercises, so that a country, a community, a village, and therefore also several countries together or a region and the world itself can be prepared better. That was an area where the discussions were coming in, that the One Health approach should be core to a global health emergency preparedness and response.
The first traditional medicine summit of the WHO was held in Gandhinagar, Gujarat last month. The summit was jointly convened by WHO and the Government of India. WHO is advocating for traditional medicines, TRM, and the focus is to combine contemporary and traditional medicines in the national healthcare system worldwide. So I have a few questions here. Why is the push so hard for mainstreaming of traditional medicines? Why now? And what makes traditional medicine system of India, the science of Ayurveda, so relevant in the current and rapidly evolving global ecosystem?
There is no push. It's always been there. In fact, the origins of quinine, or the cinchona bark, came from a bark of a tree in the Andes in Peru, which were used by indigenous peoples to cure fevers or cure malaria. They didn't know what to call it then yet. Fast forward to the 80s, 70s, it was discovery of artemisinin from sweet wormwood, which is now core to any malaria strategy or treatment in any country for malaria elimination. So the idea of the Global Center for Traditional Medicine set up in Jamnagar in Gujarat, inaugurated by our Director General Dr. Tedros and Honorable Prime Minister Narendra Modi, is to bring traditional health systems, traditional medicine into the realm of scientific evidence and rigor, so that we are able to learn from these wisdom of traditional medicine, traditional health, and bring them to the present with that evidence base, at the same time innovate from it. So that was the discussion of the first WHO Traditional Medicine Global Summit. It brought together practitioners. Actually, in many countries, there are ministers for traditional medicine and, of course, researchers, so that there is a way to validate any evidence that is, or claims of certain traditional methods of healing into the scientific realm. In terms of Ayurveda, of course, Ayurveda has been there long. And of course, it's also a source of many, many possible cures for possible other diseases. And the challenge is that with traditional medicines and traditional health approaches, there might be new methodologies that are needed for us to get that evidence out. That was really the purpose of the center and the summit.
World Health Organization, or WHO, has 4 strategic priorities for India, and I believe one of them is the pharmaceutical sector. How is WHO helping India when it comes to research and development for medicines for critical drugs, and what is being done to assure that quality of drugs is not compromised in the process?
The pharmaceutical sector, it is a secret that India is the pharmacy of the world, and especially with the vaccines that are used globally for routine immunization. 70% of the world's vaccines are produced in India and distributed worldwide to get to the arm of a child and get protected from a vaccine-preventable disease. So WHO has certain systems such as pre-qualification, which is a very rigorous system to check the quality and standards of manufacturers of these medical products, medicines, vaccines. So that's one area. India is also home to a lot of research institutions, a lot of talent in research and development. Of course, it's a country that can produce. So during the COVID, in fact, it was the country with the largest number of solidarity trials, unity trials, for finding evidence and information around the possible therapeutics and diagnostics for COVID. And our role is actually to keep supporting that manufacturing quality through that system of pre-qualification of the WHO. More important is to really bring researchers together, to have access to research institutes of other countries, gaining state of the art, and also for India to be able to show its capability in research and development.
I would like to bring your focus back to India's G20 presidency. The world faced once-in-a-century pandemic COVID-19, as you have already mentioned, which taught us that the world has to act jointly to deal with the healthcare crisis and no country can function in silos. In accordance with India's vision of global healthcare governance, India has actively participated for establishing pandemic treaty and a pandemic fund. Can you please throw some light on exactly what these two are?
First, the pandemic fund was launched actually in last year's G20 under the presidency of Indonesia. It is managed by the World Bank, where many countries have also pledged funding. India has also provided funding for that. It is meant to fund pandemic preparedness. Usually in any emergency, there is always funds available for response, but not for preparedness. So through a period of proposals review, countries provided proposals, and now the first tranche has gone for approval of certain proposals in countries. That's with the pandemic fund. On your issue of the pandemic treaty, so that's a larger piece. It is, the secretariat is actually WHO, the inter-country negotiating body, or INB, is actually working with all countries to look at framework where countries can be accountable to prepare for, respond to, and recover from any possible pandemic, even prevent a pandemic. That's a process that will take some time, but the target is by May next year at the World Health Assembly that this pandemic accord, actually, it has now evolved, the term has evolved, will be there to frame how countries will cooperate with each other should an event happen or prevent an event from happening. It is of importance that the world engages India and capitalizes and optimizes its capabilities at the same time for India to do that with the rest of the world.
The Global Initiative on Digital Health, also called the GUIDE for short, was launched last month in Gandhinagar by WHO in India under her presidency. What is GUIDE and how does it align with WHO's strategic priority for strengthening India's digital healthcare system?
The GUIDE is, as it's pronounced, it's just the acronym for GIDH, but GUIDE actually tells us what it will do. It will guide countries in norms and standards. The problem now for any digital application for health is that it's all done separately. There is a digital application for hypertension, for TB, for surveillance. It's alag-alag. It's disparate, doesn't connect. The other thing is that other countries may develop one thing which cannot be operable in another country, which is sad because that will actually facilitate data sharing and further analytics, which can feed into future pandemic preparedness even. So that's one, guide for norms and standards. The next is a guide for investments. This can only really work if there is an investment from countries. Domestic investment that will push for digital applications for health. There are many digital applications as we have seen, whether it's for economy, RuPay, anything you do now, you can transact really digitally. But there's not much for health. Although in that aspect, India is also leading in how it's using the Aadhaar card. But a better example is actually investment in COVID. During the pandemic, we have seen how India has invested in that. And it was not just a system for the country, it was also offered to other countries. So that's the idea. Lastly is to guide countries and how to plan and implement these plans that they have for digital health approaches, applications, or the digital health ecosystem in countries. And again, India has the components and elements already of that set up. Again, that's the whole idea, is to be able to share it again with the world.
Mental health or mental well-being is WHO's another strategic priority for India. In a little more than a month from now, we will celebrate World Mental Health Day. When we talk today, where do you feel India stands when it comes to mental health, and how much more work needs to be done in this particular area, as it is the most important aspect for the overall well-being of a society?
I will begin by saying to you the theme of World Mental Health Day for this year is mental health is a universal right. I think for India it has gone a long way in terms of looking at mental health as a key service or a key issue for individual or a family or a community. I think the COVID pandemic has really shown us that there are inherent problems or even of stigma, even availability of services. And again, connecting to your previous question, it was digital health applications that have helped. Telemanas is widely used right now because it anonymizes, it really respects the privacy of patients who have complaints about mental health. They can also access trained counselors as well as peer counselors. There are 20,000 adolescent health counselors whom we've trained for this purpose during the pandemic, and they're continuing with this work. And I think the future will be to really embed this strongly in primary healthcare services. And it's already happening in many states. This is really a huge initiative of NIMHANS together with the Ministry of Health. And the Health and Wellness Center will be your takeoff point for any first consult, referral, as well as treatment and support for mental health. So this is a growing area that needs to be really prioritized.
You had felicitated Asha Workers last year. So how do you view Asha Workers when it comes to their work, and can you please speak about their contribution to the society?
Asha Workers were given the WHO award for leadership in public health, and we were very proud to have nominated the Ashas, over 1 million of them, all of whom are dedicated. They do not just nutrition, they do help in surveillance. They do ensure that mothers bring their children for immunization. During COVID, it's house surveillance. Even now, in any elimination program, whether it's Kala-Azar or lymphatic filariasis or surveillance for TB, whatever it is, the ASHA is there. And to me, that's such a laudable health workforce that needs to be appreciated.
Dr. Ofrin, UN declared 21st June as International Yoga Day. Please tell us that how important it is to indulge in any form of exercise, and how has yoga benefited the world?
It's a known fact that exercise really helps us to be healthier, live longer. There's so much evidence around this. Whether it's your physical strength, gaining muscle, burning your calories or fats, improve circulation, etc. But yoga takes it at a different level. It's not just the physical strength through asanas and postures, but it's also breathing and mental well-being. I think that's the huge contribution through that one movement. Difference is the body has to be aware, is so aware that all of these are happening.
I would like to end the program on a very, very personal note. You came to India in 2020 when we were battling COVID. You have seen India then, and today when India is all prepped up to host the G20, it's brimming with pride. What is that one thing which you would always carry wherever you go from this very beautiful country?
Well, if it's just looking at the period I came in this position to now, it's really the resilience of people. There is one thing I would really think about is always remember is that when India wants to do it, they will do it. I always relay the example of COVID vaccination, for example. When you look at numbers, it looks impossible. The country is the most vaccinated population in the world.
Thank you so much, Dr. Ofrin, for sparing your valuable time. Namaskar.
Namaskar. Bahut dhanyabad.
You were listening to exclusive interview with Dr. Roderico H. Ofrin, WHO representative to India on G20 health priorities. The interviewer was Diksha Saxena, Akashvani correspondent. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on a mobile app, News on AIR.